Hello everyone, I am Dr. Swati Mehta and today's topic is morning sickness. Nausea and vomiting of pregnancy, commonly known as morning sickness, usually appear during the first trimester. Homeopathic medicines are often considered helpful in managing these conditions as they offer a wide range of remedies tailored to different symptoms patterns. Morning sickness usually begins around the 6th week of pregnancy and it is not harmful to the patient or a baby. But if patient experiences excessive vomiting and cannot manage to keep her food down, she may have hyperemesis gravidarum. About 80% of women are affected by this condition. Although several theories exist, the exact cause is not known. It is commonly thought to be related to elevated level of progesterone, HCG or estrogen, and some studies have also suggested a possible role of H. pylori infection. The mild form affects the quality of life of a woman and her family, but the severe form, hyperemesis gravidarum, can lead to dehydration and electrolyte imbalance, required hospitalization. The exact cause of vomiting in pregnancy is unclear, while changes in serum hormone levels are also blamed. Social and psychological factors may also play a role. High level of HCG can increase thyroxine levels, and about 60% of the women with hyperemesis gravidarum shows biochemical or clinical hyperthyroidism. This condition is commonly in early pregnancy and may continue until the 5th month. Again, talking about causes, the causes are largely unknown but may include high level of hormones such as HCG, ACTH, estrogen, progesterone, leptin, prolactin and thyroxine. Psychological factors may also contribute. Other possible causes include nutritional deficiency, that is low carbohydrates, vitamin B6, B1 and protein deficiency, as well as allergic and immunological factors. The chart illustrates how ovarian hormone and psychological factors affect the stomach through the liver. Chronic hormonal influences, especially estrogen, progesterone and HCG, reduces gastric motility and secretion. As a result, stomach function slows, leading to the development of nausea and vomiting. Signs and symptoms include nausea and vomiting in early pregnancy, persistent or excessive vomiting, dehydration with decreased urination, maternal weight loss or failure to gain weight, rapid heartbeat, headache, confusion, and general weakness. Women with uncomplicated morning sickness are often noted to have better pregnancy outcomes, including fewer miscarriages, fewer preterm deliveries, fewer stillbirths, fewer cases of low birth weight or growth restriction babies, and lower mortality. Management of uncomplicated morning sickness: assurance had to take dry toast or biscuit before rising from the bed, avoidance of fatty and spicy food, and advice to take plenty of fluids. A possible complication is hyperemesis gravidarum, which is characterized by persistent uncontrollable nausea and vomiting that may continue beyond 20 weeks of pregnancy. 70 to 85% of the pregnant women experience nausea and vomiting. Amongst these, 2 to 5% of women experience hyperemesis gravidarum. It is defined as excessive vomiting and nausea occurring before 20th week of gestation. The vomiting is intractable, occur irrespective of food, and severe enough to require hospitalization. Causes of hyperemesis gravidarum is psychological, that is first pregnancy. There may be a family history of a mother. Hydatidiform mole is a condition where there is no pregnancy but it is a disease condition of chorionic villi. There may be multiple pregnancy, more than one. and unplanned pregnancy. All this leads to hyperemesis gravidarum. These are the theories which I already explained in above slides. Clinical features of hyperemesis gravidarum: there is inability to retain the fluid or fluid, dehydration, dry coated tongue, skin turgor decreases, acetone breath and ketonuria, significant weight loss. There may be development of jaundice and various palsy, metabolic acidosis, and if weight loss is greater than 5% of pre-pregnant weight of the patient, it is associated with poor fetal growth. So we have to take precautions for this during antenatal care. Same explanation, so I am not repeating again. Hyperemesis can be aggravated by hunger, fatigue, prenatal vitamins, especially those contain iron, and diet. Hyperemesis gravidarum tend to begin somewhat earlier in the pregnancy and last significantly longer than the morning sickness. Here there are the sources and etiology with the pathophysiology. Placental corpus luteum, that increased level of HCG. In placenta, estrogen and progesterone secretion is more. In GIT, H. pylori can be infected. And psychological, that is possible effects of culture and environment. Complication of hyperemesis gravidarum: the first common is weight loss because patient is not able to eat properly, dehydration because she is not having proper fluid, metabolic acidosis from starvation, alkalosis from loss of HCl, and hypokalemia, that is electrolyte imbalance, because all the things are disturbed. Hyperemesis gravidarum is associated with increased maternal adverse effects, including splenic vein thrombosis, esophageal rupture, Mallory Weiss tears, pneumothorax, neuropathy, and preeclampsia. It is also linked to fetal complications such as increased fetal growth restriction and higher fetal mortality. Here, about the morning sickness: when it is converted into excessive vomiting, there may be dehydration or starvation. If dehydration is there, then there is raised blood urea or there is hemoconcentration. In case of renal system, urine oliguria, concentrated urine, low urine chlorides, ketonuria, proteinuria, or bile salts. If there is starvation, then it develops ketosis, emaciation, polyneuritis leads to wrinkles, encephalopathy, hepatitis, then again it leads to ketonuria, proteinuria, and bile salts. Management of hyperemesis gravidarum depends on the dietary measures, emotional support, acupressure, ginger, and chiropractic. The patient of hyperemesis must admit to the hospital. To manage the dehydration, we have to advise patient to go for IV fluids. Oral intake must be restricted. We have to differentiate some of the conditions where nausea and vomiting is persistent, like urinary tract infection or any surgical cause like appendicitis or bowel obstruction. Blood investigation must be done, especially for hemoglobin, urea, electrolyte, liver function test, and thyroxine level. We have to provide the food by the nasogastric tube, and all these things must be done by gynecologist, not by a homeopath. In case of dietary measures, we have to advise patient to drink small amount and often, especially the lemonade, because lime will help to reduce, and the jeera, if we are putting jeera in the lemonade, it will help to reduce the eructations and the nausea. Diluted fruit juice or weak tea, clear soup she can have. Avoid having empty stomach, so every time she has to feed herself very little and often. Early morning nausea may be helped by eating dry biscuits before getting out of bed. Salty foods may help, especially the potato chips or salty biscuits. And patient has to try sucking on barley sugar or boiled sweets. And she has to avoid fatty, rich or spicy foods. She must fix the best time where she can able to eat nicely, and she have to eat when she feels hungry. If smell or hot food make her feel uh, ill, then try having cold food instead of the hot food. If possible, avoid cooking and ask for help from the friends and family. Patient has to lie down when nauseated and avoid stress. If patient is preemie, she may become depressed or exhibit other mood changes because of the excessive vomiting and nausea. So family support is critical. Psych consultant may be indicated if she is depressed. There may be domestic violence is suspected and evidence of substance abuse. Acupuncture and acupressure both will help in case of hyperemesis gravidarum. Acupuncture requires a trained practitioner, but acupressure we can do at our clinic, and the how to do acupressure, the explanation is over here. Fisher and Rasmussen in 1991 demonstrated that 1 gram of ginger powder per day reduces symptoms of hyperemesis gravidarum. So ginger is the best remedy we in India considered, and in every type of food we are using ginger, so that will helpful for the normal persons also. Differential diagnosis of hyperemesis gravidarum. The conditions that can also present with nausea and vomiting includes acute abdomen, gastritis, preeclampsia, hypertension, liver disease, thyroid disease, and molar pregnancy. But what if non-resolving or worsening symptoms or nausea begin after 9 weeks of gestation? Then we have to consider the other causes. Non-morning sickness causes of vomiting include various medical, surgical, and gynecological conditions. Medical causes includes intestinal infestation, urinary tract infection, metabolic disorders, hepatitis, diabetes ketoacidosis, uremia, and neurological disorders. Surgical causes includes appendicitis, peptic ulcer, intestinal obstruction, and cholecystitis. Gynecological causes include twisted ovarian tumor or cyst and rate degeneration of fibroids. Again, talking about the complications: dehydration, electrolyte imbalance, renal failure, Wernicke's encephalopathy, that is thiamine deficiency, vitamin K deficiency, maternal coagulopathy, or fetal intracranial hemorrhage. A Mallory Weiss tear is a tear in the mucosal layer at the junction of the esophagus and stomach. In this picture, you can find it out where it is. Complications of Mallory's tear is characterized by upper gastrointestinal bleeding secondary to transmural perforation of the esophagus. The changes are generalized manifestation of starvation and severe malnutrition. Liver, there is a centrilobular fatty infiltration. Kidney, fatty changes in the proximal convoluted tubule. The heart, subendocardial hemorrhage. Brain, small hemorrhage in hypothalamic area. Wernicke's encephalopathy, apathy, restlessness, sleeplessness, convulsion and coma. And Korsakoff psychosis, that is confusion, loss of memory. Chart shows the symptoms of mild, moderate and severe type of vomiting in pregnancy. What are the points required to take complete history is discussed over here. What precautions we have to take for the physical examination, or what we have to find out in physical examination is described here. What are the investigation must be done for the cases of hyperemesis gravidarum? is described here. Homeopathic therapeutics are based on the patient's sign and symptoms and the principle of similarity. Since different women experience different symptoms during the first trimester and sometimes into the second or even in third trimester, the treatment requires matching the patient's symptoms pattern with the corresponding medicine and prescribed accordingly. Lactic acid is indicated in the patients with morning sickness marked by copious salivation and water brush, especially in pale anemic women. The tongue is dry and parched with burning heat rising from the stomach to the throat and profuse tenacious mucus. The patient is thirsty and has voracious hunger, a constant desire to swallow, and sensation of fullness or lump in the throat. Nausea occurs on waking and is relieved by eating. It is also useful in pregnancy associated with diabetes with frequent passes of large quantity of saccharine in urine. So when patient is gulping constantly without any, you can say empty gulping, we can use lactic acid. Water brush is there, copious salivation is there, and patient is anemic. Tabecum is indicated when nausea is accompanied by extreme weakness, death-like pallor, icy coldness, cold sweats, and an intermittent pulse along with gastralgia. The patient wants the abdomen uncovered and the smell of the smoke triggers nausea and vomiting. Smell especially of tobacco aggravates the condition. Vomiting is violent, worse with the least motion and may even include fecal matter, with cold sweat appearing as soon as she moves. It is often used when lactic acid fails and is marked by great prostration, muscular relaxation, free secretions, and persistent vomiting. Mentally, the patient may feel weak, confused, forgetful, fearful of being arrested or murdered, and may have severe itching over the whole body during pregnancy, with disturbed or dull sleep at night. So when patient is having constant spitting here and there and nausea and vomiting of first the food, then after the bile, and at last the fecal matter. This is written in Allen's keynote. So these are the symptoms for tabecum. Colchicum is indicated when there is an extreme nausea and faintness from the odor of cooking food, especially fish, eggs, or fatty meat. The patient is nauseated by smell or even the sight of food, with profuse salivation and a sensation of dryness in the mouth. The abdomen is greatly distended with gas, feeling as if it would burst, and there is vomiting of mucus, bile, and food, aggravated by any motion. There is marked coldness in the stomach, cravings for various foods, but aversion to them on smelling, particularly fat and the alcoholic beverages. Symptoms may follow grief, with patient being irritable, sensitive to impressions, and intolerant of strong odors. Heat in the mouth with thirst is present. The patient feels better when lying quietly and nausea or vomiting is triggered by swallowing saliva. Colchicum is considered one of the key remedies along with arsenic and sepia for nausea and vomiting caused by smell or sight of the food. Ipecac is considered when there is constant persistent nausea with or without vomiting, accompanied by profuse salivation, clean tongue, and no thirst. These are the main symptoms or key symptoms of this medicine. Vomiting consists of large quantity of white glary mucus without relief, and the patient often feels sleepy afterward. Symptoms are aggravated by stooping. The tongue is clean yet nausea is constant. The stomach feels relaxed as if hanging down with clutching, squeezing or griping pain in intestines. Nausea, shortness of breath commonly accompany the complaints. The patient may awkward, stumbling easy, sad contemptuous, and desire others to share this feeling. Sudden fainting pallor with blue discoloration around the eyes or lips. There is desire for sweets and a sinking or relaxed sensations are noted. There may be vomiting of blood, food or mucus, ineffectual urging to urinate, alternating sensations of heat and cold in limbs, shocks on falling asleep, and loss of sleep leading to nausea and fatigue. Arsenic alb is indicated in the patients with great exhaustion after the slightest exertion, marked mental restlessness with physical weakness and anxiety. There is intense thirst for cold water taken frequently in some small sips. Gastric pain occurs from even small amount of food or drink, especially after cold food, cold fruits, ice cream, ice water, sour food, alcohol, strong cheese, or spoiled food. The patient cannot tolerate the sight or smell of the food with nausea and vomiting soon after eating or drinking. The similar symptoms of ipecac and colchicum and sepia. There is craving for acids, milk and coffee with heartburn and regurgitation of sour or bitter burning fluids. Mentally, the patient is extremely nervous, anxious, and restless, fastidious, and fearful, especially fear of death, starvation, financial loss, or being alone. There may be a trembling, fainting, jerking, hypersensitivity, and obsessive or self destructive tendencies. Hallucinations and lack of confidence can be present. The tongue is dry, clean, red with red edges showing teeth marks or imprint of teeth. Other features including grinding of teeth during sleep, burning in the stomach relieved by hot food or drink, heat sensations, cough and diabetic tendency with urinary disturbances. Then we have to use arsenic. Sorinum is indicated in pregnancy for very obstinate vomiting, often aggravated by fetal movements, especially when well-selected remedy fails to give relief. So the fetal movement starts after 5th month. We can use is this medicine. The patient has an offensive body odor despite bathing and feels chilly, wanting warm clothing even in summer. Discharges and flatus are foul smelling like bad eggs. There is intense hunger with the need to eat even at night. The face appears pale, dirty or puffy, and the tip of the tongue burns, leaving a persistent bad taste in mouth. Mentally, the patient is anxious, hopeless and despairing of recovery, with gloomy thoughts and suicidal tendencies. There are fears of fire, being alone, or becoming insane, along with aversion to work. Physical signs include obstinate cracks at the corners of the lip, bitter taste in mouth, loss of appetite after illness with great thirst, desire for bread and acids, and frequent urination due to bladder weakness. So these are the symptoms of sorinum. It is a nosode, so we can use as an intercurrent medicine with all these therapeutics. Phosphorus is indicated when nausea is triggered by placing the hands in warm water, with regurgitation of ingesta and vomiting of water as soon as it becomes warm in the stomach. It is useful in postoperative vomiting and when the cardiac opening feels constricted, so that food is scarcely swallowed and comes back up. There is inflammation of the stomach with burning extending to the throat and bowel, and symptoms may follow excess salt intake. The patient has ravenous hunger, especially at night, with an empty, hollow feeling in the stomach. Complaints may arise from anger, fear, grief, worry, or tobacco. The patient feels better after eating and sleeping. Mentally, there is a strong need for sympathy and an aversion to seeing water, even bathing with eyes closed. There is craving for cold drinks, coffee, salt, acids, and spicy foods, though water may aggravate the symptoms. Water brush is present and rubbing the abdomen gives her relief. Apomorphine is indicated when there is intense nausea with marked languor and increased secretion of sweat, saliva, and mucus. There is a violent inclination to vomit with a generalized feeling of sickness throughout the body and strong gag reflex, especially during pregnancy. Associated symptoms include pain between the shoulder blades, along with insomnia and constipation. Symphorecarpus racemosa is indicated for the persistent vomiting of pregnancy and can be used in cases of hyperemesis gravidarum. It is marked by gastric disturbances with nausea, water brush, bitter taste in mouth, the constipation. Nausea is aggravated by any motion with aversion to all food and is relieved by lying on back. The smell and thought of food are repugnant, making it highly recommended remedy for hyperemesis gravidarum. You can say it's a specific medicine for hyperemesis gravidarum, and I had many results in case of persistent nausea and vomiting with the help of Symphorecarpus racemosa. I am recommending that you can use this for your patient. Nux moscata is used when nausea and vomiting are associated with marked dryness. The mouth and tongue are extremely dry with tongue sticking to the roof of the mouth. Saliva feels like cotton and the throat is dry and stiff, yet there is little or no thirst. There is irresistible drowsiness, hiccup, and craving for highly seasoned food. The abdomen is greatly distended and the patient faints easily, feeling better after stool. Dryness, both as a sensation and in actuality, it is a key feature of this medicine. All complaints are accompanied by drowsiness, disturbed digestion, and a marked tendency to faint. So we can use this medicine in case of hyperemesis gravidarum and its complication. Mentally, the patient is dreamy and confused with sudden loss of thoughts while speaking, reading or writing, use of the wrong words, and even loss of memory of past events. She may answer irrelevantly, having difficulty chewing and swallowing, loathing at the thought or sight of food, and overall weak digestion. So again, I am advising you to recommend this medicine for hyperemesis gravidarum because there is severe dryness, there is a dryness and the stiffness of the tongue, flatulent is more, and drowsiness is also one of the complication you can consider in case of hyperemesis gravidarum. Nux vomica is indicated for the nervous, excitable, highly sensitive woman with constant nausea, especially in the morning or after eating, with a strong desire to vomit for relief. Vomiting may be violent, bilious, and sour. The stomach and epigastric region are extremely sensitive to pressure with a sensation of a stone or heaviness several hours after eating. The patient cannot tolerate tight clothing around the abdomen. There is heartburn and water brush with indigestion from strong coffee. The patient craves stimulants and fatty foods, which are often well tolerated. It is especially useful for the woman leading a sedentary life with excessive mental work. Mentally, the patient is active, irritable, angry, and impatient with a fiery temperament. She may be fault finding, hypochondrial, or headstrong and self willed with extreme sensitivity to noise, light, odors, touch, and even music. There may be morbid thoughts, including suicidal or homicidal impulses, fear of sharp objects, and increased anger when consoled. So in case of nux vomica, when patient will tell you that I am vomiting, putting my two fingers in, and that feels better, that is the strong indication of nux vomica. Creosote is used for vomiting of pregnancy characterized by nausea and vomiting after eating, with food often vomited several hours later in an undigested state. Even the smallest amount of water can provoke nausea and vomiting. There are sour or foul eructations, excessive salivation, and a sensation of icy coldness in the stomach, as if filled with ice water. Soreness, often the stomach is relieved by eating, with a bitter taste after swallowing water. Mentally, the patient is apathetic, forgetful, irritable, and confused, with wandering thoughts. Music may cause weeping and the palpation. There is burning in the stomach, fullness, great debility and restlessness, wanting things, testing them, then rejecting them, and desiring something else. The patient may feel dissatisfied, long for death, and having fear and anxiety, especially in the woman during pregnancy. So when patient is having high gastritis, or you can say more secretion of HCl in the stomach during pregnancy, we can use creosote. I am thankful to everyone watching my video. These are medicines I have used in my own clinical practice, and if they help anyone in their practice or benefit the patients, I would be truly grateful. I believe that sharing knowledge can help others, and I thank you all from the bottom of my heart.